everyone. I am Bulelwa Huna, the Senior Specialist Occupational and Hygiene at the Department of Employment and Labor in South Africa. Today, I want us to talk about the use of hand sanitizers and disinfectants. The era of COVID-19 has taken us back to basics and reminded us the critical importance of practicing personal hygiene. It is important to note that we can contract COVID-19 by breathing in the droplets coughed or exhaled by a person with COVID-19. In addition, we can contract COVID-19 by touching contaminated surfaces or objects and thereafter touch our eyes, nose, or mouth. Some people infected with COVID-19 may be asymptomatic and experience mild symptoms and recover, but they may spread the virus during this stage. The coronavirus is an envelope virus and is therefore susceptible to standard environmental cleaning and disinfection methods. Each one of us can help stop the spread of COVID-19 and other infectious diseases by washing our hands regularly with soap and running water for 20 seconds or more, and by regularly cleaning surfaces. With respect to the washing of hands, there will be instances where water is not readily available. In such cases, it is recommended that hand sanitizers containing at least 60 to 70% alcohol be used. Do not use the hand sanitizer if the hands are visibly dirty or greasy. Instead, wash with soap and water, as that will inhibit the alcohol from attacking and destroying the protein that envelopes the virus. It should be remembered that the hand sanitizer and the disinfectant are chemicals, and therefore instructions on how to safely use such products must be followed at all times. It is recommended that consumers do not make their own hand sanitizers, because if made incorrectly, such hand sanitizers can be ineffective, and there have been reported cases of skin burns from homemade hand sanitizers. To reduce the potential spread of the coronavirus in non-healthcare settings, such as in the home, offices, schools, gyms, or restaurants, because we like going out, or even in religious settings, it is important that in such settings, high-touch surfaces be identified for priority cleaning and disinfection. The disinfectant and its concentration should be carefully selected to avoid damaging surfaces and to avoid or minimize toxic effects to the users. Surfaces should always be cleaned with soap and water or a detergent to remove organic matter before disinfecting that particular surface. Do not use disinfectant sprays or wipes on the skin, because they may cause skin and eye irritation. Disinfectant sprays or wipes are intended for use on hard, non-porous surfaces. Disinfectants that are being used are also required to be registered with a national regulator for compulsory specifications, as the virucidal properties of the chemical must be verified, because it is important that we do not go out there and buy products that have not been verified with the regulator for compulsory specifications. The hand sanitizer should be stored out of reach of children. It should never be stored above 50 degrees Celsius. For example, we are entering summer now, it is very hot. It is recommended that we do not leave such products in the car, as they may cause combustion. These products are flammable and should be stored away from heat or flames. So in the home, don't leave it next to the stove, because it can cause serious fire problems. The hand sanitizer should be rubbed into the hands until they feel completely dry before continuing activities that may involve heat, sparks, static electricity, or open flames. Social gatherings are allowed now. We'll be busy buying, therefore be careful when you use the hand sanitizer. The hand sanitizer is dangerous when swallowed and ingested. Remember, we said it is a chemical. Drinking a small amount of the hand sanitizer can cause alcohol poisoning. Consumers are warned about hand sanitizers that contain methanol because it is dangerous and a toxic substance. Methanol can cause serious side effects when absorbed through the skin and can cause blindness or death when swallowed. Methanol exposure can also result in nausea, vomiting, headaches, blurred vision, permanent blindness, seizures, coma, permanent damage to the nervous system, or even death in some cases. People who have been exposed to hand sanitizers containing methanol and thus experience symptoms should seek immediate medical advice. Criminal analysis of poisoning cases caused by non-intentional and intentional consumption of hand sanitizers and disinfectants confirm need to pay close attention to the safe use of such products. In the workplace, the employer should provide hand washing facilities and running water with soap. Obtain a safety data sheet with product information for all the hand sanitizers and disinfectants that are being used. So it is the responsibility of the employer to make sure that when they procure such products, the supplier provides those safety data sheets so that people will know what are the precautionary measures they need to follow should there be accidental exposure. Provide hand sanitizers at entry locations as the employer. This will be in addition to washing rooms, as they should be already in place. Make sure that surfaces remain clean. This may mean increasing the level and frequency of cleaning, as well as cleaning surfaces that you may not ordinarily clean. Clean equipment between uses to make sure that we reduce the spread of the virus. This includes shared equipment in the workplace, tools and vehicles that are being shared. They must be cleaned and sanitized in between uses. Frequently clean and disinfect objects and surfaces that are touched regularly. In summary, when using hand sanitizers, apply only a small coin-sized amount on the hands. There is no need to use large amounts of the product, but make sure that the hands stay moist for about 30 seconds. Avoid touching the eyes, mouth, and nose immediately after using the alcohol hand-based sanitizer, as it can cause irritation. Hand sanitizers are alcohol-based and therefore can be flammable. Under no circumstances drink or let children swallow an alcohol-based hand sanitizer, as it can be poisonous. If you are concerned that someone has swallowed and ingested a hand sanitizer, or there have been accidental exposure to cleaning chemicals or disinfectant, please contact the Poison Information 24-hour helpline at 0861 555 777. 0861 555 777. Help is afforded at all times. They take calls from the public or healthcare professionals and will advise on the way forward. Thank you for listening to this video. We look forward to seeing you again.